extraction. You are taking anticoagulant like warfarin, aliquots, or Xarelto, you should know what to do prior to dental extraction. If a simple extraction, like one tooth extraction, I would recommend not hold any retinal patient. But I would recommend test your eye now prior to the procedure if you are not stable. If your eye now you have a lot of eye now out range, especially higher your upper range. You should check your eye now prior to procedure. So if you have multiple tooth extractions, then I would recommend to hold from 2 to 5 days prior to the procedure. You should check with your dentist or oral surgeon. You see what they expect. Some dentists they may tell you they want eye between 2 and 3, or they want eye less than 2 prior to the procedure. Then you will let your doctor who manage your warfarin know that your eye expect to be at certain level prior to the procedure. Usually, they want your eye on the day or within 24 hours prior to the procedure. So if depend if your eye excuse me, if your eye not stable, or higher than the upper range, like a week or 2 weeks prior to the procedure, then your doctor may recommend that you should hold your warfarin to make sure you get or you achieve the eye goal. Expect to be within 24 hours. So, for example, if your eye like 3.5, 2 weeks prior to the procedure, right? So, I would recommend you need to hold your warfarin 1-2 days prior to the procedure, and then you need to detach the eye on the day of procedure. So to make sure your eye at 2.3, 2 to 3, that what your dentist want. If your dentist want your eye less than 2 prior to the procedure, then you might need to hold for 3 days. If your eye for 3.5, 2 weeks prior to the procedure, and you need to hold like 3 days prior to the procedure to make sure your eye less than 2. So it still depends on what your dentist want or expect your eye level or goal for the procedure. If you have to hold your eye hold your warfarin for 5 days prior to the procedure, okay? Sometimes they have difficult or multiple tooth extraction. They might want you to hold for 5 days prior to the procedure. They want the eye level less than 1.5. And you need to hold your warfarin might be for 5 days or more, depending on your iron level. So you have to follow your doctor closely to make sure you don't have any bleeding. So if you have to hold your warfarin for 5 days to get the iron at less than 1.5, then you may need to be breached with the low-enough injection or enoxaparin injection to avoid, you know, the blood clot or stroke, because you take warfarin to prevent the blood clot or stroke. And then if you require to reach with the low enough injection, then there's a instruction, when to start the low enough and when to resume low enough injection. You have to follow the doctor who manage the doctor who managed your warfarin. If you take Eliquid, Xarelto, or Badaxa, it's easier to manage prior to the procedure. Generally, for a simple extraction, you don't have to hold Eliquid, Xarelto, or Badaxa. But for multiple tube extractions or extensive oral surgery, then you might need to hold for 1 to 2 days this medication prior to the procedure. You don't have to be breached with the luminal injection when you hold less than 3 days. I think generally is safe. It's safe for certain patients. They are so sensitive when they hold their blood thinner medication, even though 2 days they may develop the blood clot or stroke. So for those patients, the surgeon or the proceduralist might need to consider the risk and benefits of holding the blood thinner medication. So that's a very complicated patient. Need to work closely. They may need to be stay at the hospital before procedure to make sure they are safe, or stay after the procedure for days to make sure they are safe from bleeding or blood clot or stroke. If you have to hold your warfarin or the Eliquid, Xarelto, Badaxa, then resume your blood thinner medication as instructed by dental or the surgeon. So, prior to the dental extraction procedure, you need to know if that a simple extraction or multiple tool extraction. If simple extraction, you may not need to hold your blood thinner medication. If multiple tools extraction or extensive oral surgery, then you may need to hold your warfarin for 2 to 5 days, depending on your iron level. And then if you hold more than 3 days, then depending on your medical condition, you need to be breached with the luminal injection to make sure you are safe from blood clot or stroke. And if you take Eliquid, Xarelto, or Badaxa, you may require to hold 1 to 2 days prior to the multiple tooth extraction or extensive oral surgery. And then you should resume your blood thinner medication as instructed by your dental. And if you have to be bridged with Lovenox injection, then you have to follow your doctor who manage your warfarin to make sure you know what day you need to start the Lovenox and what day and when you resume your Lovenox and when to stop the Lovenox injection. All right, if you have any further question for this dental extraction procedure, please let me know in comment below. Thank you. For the dental cleaning procedure, what you need to do prior to dental cleaning procedure, if you are taking blood thinner medication like warfarin, Aliquid, Roto, Badaxa, so I would recommend that you should not hold blood thinner medication for routine dental cleaning. If your INA, if you're taking warfarin, you need to make sure you are stable with your INA level. You don't have clinical INA before routine cleaning. If you have critical INA, probably you need to hold your warfarin for a few days in order to get your INA to the therapeutic level. So avoid your routine cleaning if you just have the critical INA like over 5 or your INA over 6 or you have any kind of active bleeding when over or blood thinner medication. For the deep cleaning, if you have to have a deep cleaning in on blood thinner medication, might consider to hold your warfarin. You need to check with your doctor who manage your blood thinner medication. They have to review your INA history, and then they will give you some recommendation on your warfarin and your INA history. Generally, if you have a stable INA history, then you know, and then your current INA is therapeutic, then they might recommend that you hold for 1 day prior to the procedure. If your INA, you know, if your INA is not stable and has the history of elevated INA, then they may recommend that you should hold for 3 days prior to the procedure. But they need to test your INA prior to the procedure, usually within 24 hours of the procedure. And then if you are taking the Aliquid, Yeroto, Abadaxa, um, and then you don't have any kind of bleeding or anything, any active bleeding, such as nose bleeding, stomach bleeding, or blood in your urine. And then you might need to hold for 1 day, right, to keep cleaning. And again, if your dentist, they are not concerned about your bleeding, then they don't recommend you have to hold your blood thinner medication, then you should not hold your blood thinner medication. You don't have any concern about bleeding. If you are uh, stable with your warfarin doses, and then you have a good history of your INR, your INR therapeutic for a long time, then you should follow your dental recommendation. If you have concern, you should always ask your doctor who manage your warfarin. Make sure you are safe from any procedure. Okay. If you hold your warfarin or your Eliquis, you should resume your blood thinner medication as instructed by dental. If you have any question, you ask your doctor who manage your warfarin when you resume your blood thinner medication. Generally, if you don't have any kind of bleeding or if you don't have any instruction from your dental when to resume your warfarin, then you know your uh, doctor who manage warfarin might um, have you to resume your warfarin uh, after the procedure, but you need to double check you are safe. All right. So, any further question or any concern uh, prior to dental procedure? What you need to do when you are taking the platinum medication? Please let me know in the comment below. Thank you. Bye. Prior to dental fillings procedure, what should you do if you are on platinum medication, such as warfarin, Eliquis, Xarelto, or Bedaxa? You don't have to hold your platinum medication prior to a dental fillings procedure unless otherwise as instructed by your doctor who manage your warfarin or your anticoagulant or um, your dental or your oral surgeon. Okay. Um, if you have a unstable, you have an unstable INR history, then you may consider to recheck your INR. If you have uh, a critical INR recently, then you should check your INR, make sure your INR is not too high prior to the procedure. If you have any active bleeding, you should let your dental or your surgeon know that you have active bleeding. But I don't think that they need to do, uh, they need to postpone the procedure, this procedure, because you have bleeding, you are not too high. But if you need to talk to them to make sure they don't do anything else besides the fillings. They require you to hold your warfarin, and you need to follow your doctor who manage the platinum medication or the anticoagulant And if they require you, if you're taking the Aliquix, Xarelto, or Badaxa, and they require you to hold your platinum medication whole day prior to the procedure, you have to hold. And if you have to hold your platinum medication, then you resume your platinum medication instructed by your dentist or your surgeon. If they don't have any recommendation, they have no idea when to resume, then you need to check with your doctor who manage your platinum medication or the anticoagulant, the when you should resume platinum medication. If you don't have any higher bleeding after procedure, then might resume your platinum medication on the day after the, or even uh, same same day of the procedure. You have no bleeding. So, all right. So again, before a dental fillings procedure, you don't have to hold any platinum medication. That's otherwise that's instructed. And then you don't have any stable iron history, critical iron recently, then check your to the higher bleeding risk um, procedure. Um, and I just say for the fillings, you should not worry about iron history or bleeding. But if you have live threatening bleeding, probably do anything at the hospital eye, then they have puzzle patient push your bleeding back to normal. All right, if you have any further question or concern prior to a dental procedure, please let me know in the comment below. Thank you. Before uh, a dental root canal procedure, what should you do if you are on platinum medication, such as warfarin, Eliquix, Xarelto, Bardaxa? Um, I would recommend you should not hold your platinum medication. Otherwise, as instructed by your doctor or your anticoagulant. If you if you have unstable iron history, uh, your uh, recent iron was critical, too high, then you should check your iron prior to the procedure to make sure you are safe from the procedure. Um, if your iron is therapeutic or you have history of stable iron, good iron history, then you don't have to hold your warfarin right to. unless otherwise as instructed by your um, doctor who manage your warfarin or the anticoagulant clinic. Or if your dental or your oral surgeon recommend that you should hold your blood thinner medication, then you need to discuss with your um, doctor who manage your warfarin or the anticoagulant to make sure that you hold your blood thinner medication appropriately. So if you have unstable INR history or your INR was critical recently, you should check your INR, make sure you are safe. And if you have any active bleeding, you should let your doctor or your anticoagulant clinic know that you have some kind of bleeding, like nose bleeding, stomach bleeding, or blood in urine. You should let your doctor and your dentist, your oral surgeon know before the procedure. Your dental or your oral surgeon may request or may require you to hold your warfarin or your Alaquip, your Atorbadaxa. So if you require to hold your warfarin, work with your doctor or your anticoagulant, how many days you should hold your warfarin, or what is the INR level they want before the procedure. And then if you require to hold your Alaquip, your or Badaxa, then I would recommend you should hold for 1 day prior to the procedure. And if you have to hold your warfarin or your Alaquip, your or Badaxa, then you need to resume your blood thinner medication instructed by your dental or your oral surgeon. If you don't have any instruction or any recommendation from your dental oral surgeon, then you need to check with your doctor who manage your warfarin or your anticoagulant to see if they have any. If you have any further question or concern right to a dental root canal procedure, please let me know in the comment below. Prior to dental scaling procedure, so what should you do when you are taking a blood thinner medication, that warfarin, Eliquis, Xarelto, Adaxa? I would recommend you should not hold blood thinner medication otherwise as instructed by your doctor who manage your warfarin or your clinic who manage your warfarin. Or your clinic who manage Aliquis, Xarelto, or Badaxa. If you are taking warfarin and you have unstable INR history, then you need to check your INR to make sure you are not critical prior to a procedure. So if you have a critical INR, you should hold your warfarin until your INR back to the therapeutic level or uh, below your range, be safe for the procedure. Um, if you are stable with your warfarin and you have a INR in RAM, you may platinum your warfarin. Okay? If you don't have any active bleeding or any concern about bleeding, then you don't have to hold your platinum medication prior to dental scaling. If you have to hold your platinum medication prior to the procedure, as instructed by your dental, then you need to resume your platinum medication instructed. Make sure have a bleeding can control your blood clot or prevent stroke if you don't not if you take too long to consume for platinum medication. So as one way, you need to check your dentist or your oral surgeon to make sure that they have any instruction for you for the procedure. Let them know that you are on platinum medication if they have any instruction. If they have no concern, no instruction, then you should check with your doctor or the anticoag clinics to make sure they have a recommendation. So, uh, not recommend take uh, platinum medication before a dental scaling procedure unless otherwise as instructed by your dental. Um, if you are not stable with your warfarin doses, you have unstable INA history, and you have the critical INA recently, and you your doctor or your anti-coag clinic uh, make sure that they give you good instruction what to do with your platinum medication prior to. And then after the procedure, you resume your platinum medication as instructed by your dental. If you don't have any instruction, if they don't know what to recommend, then you should follow your doctor or your anti-coag clinic recommendation. Safe. Resume your platinum medication appropriately. If you have any further question or concern about before dental scaling procedure, what you need to do, and you're on platinum medication. Thank you. What should you do prior to a dental caps procedure? You don't have to hold your platinum medication prior to the dental cap procedure. That's right, actually, by your doctor who managed your platinum medication or hyperclean. If you are taking warfarin and you don't have a um, stable NR history and you have a critical INR recently, and you might need to check your INR prior to and unless your dental oral surgeon know that you have critical INR recently. If you have any active bleeding, know to make sure everything is safe. They don't do it now besides the dental caps procedure. And if they want you to hold your warfarin prior to this procedure, then you probably need to discuss with your doctor for platinum medication uh, or the anticoagulant for recommendation. Uh, if you have to hold your warfarin, follow your doctor or the anticoagulant instruction. If you have to hold your Eliquis, Xylitol, or Bedaxa, then I need one day, right? Need it again. And you need to discuss for doctor any recommend or oh if you have to hold your warfarin or Eliquis, Xylitol, or Bedaxa, you need to check dental see when you platinum. If they don't have any instruction, why they when you need to read, then you need to consult with your doctor who manage your platinum patient or your hypoac for the instruction. You have no active bleed. They might ask you to resume the platinum medication same day after the right. So prior to a dental caps procedure, you don't have to hold for platinum medication unless otherwise as instructed. Check your INI if needed. Critical INI recently or INI history not stable. Um, you have active. You should let your dental, your healthcare providers, surgeon know if you have any concern like active bleeding or any major bleeding that you have in that track for putting the medication. Okay, if you have any further questions, concern, please let know in those. prior to a total knee replacement surgery. So, what should you do if you are on platinum medication? If you are taking warfarin, then your doctor who manage your warfarin or the Coumadin clinic, they might reject your INR about 2 weeks prior to the procedure. Depend your INR result or your INR history. Then if it's too high, then they adjust your warfarin dose and have you to back in 1 week. And then if you are getting better or get into the range, then they may hold for open for 4 to 5 days prior to the procedure. And if you have a history of recurrent recurrent blood clot or recurrent stroke, then they might need to bridge you with the Lovenox injection. Okay, so when they have to bridge you with the Lovenox injection, they need to make sure you have up to days kidney labs, within 3 months of your kidney lab, and then your current weight in order to dose Lovenox. So there are some instructions regarding when to start your Lovenox injection and when to resume your. You need to follow doctor or make sure you reach the Lovenox injection correctly. And then if you take Aliquid, Gerotobadexa, your doctor, excuse me, your doctor who managed your blood thinner medication or the anticoagulant might check your kidney function. They need to update the labs as needed, usually within 3 months, and your labs okay. But if it's over 3 months, then they should recheck your kidney labs, your renal labs, so they can give you the good recommendation. If you have a normal kidney function, then probably you should need to hold for like 2 days prior to the total replacement surgery. If your kidney function, if you have some kind of acute kidney problem or have a chronic kidney disease, then based on your creatinine clearance, and they will recommend that you might need to hold more than 2 days. So if you have bad kidney function, then you might hold 3 days of depend on your function. And then if you have to hold your warfarin for 5 days, your Aliquid for 2 days or more, your Gerotobadexa 2 days or more, then you need to check with your surgeon or the proceduralist to see when you can resume your blood thinner medication. Generally, for warfarin, you may resume your warfarin the day after procedure if okay with surgeon. And then for the Aliquid, Gerotobadexa, yes, the same thing. You may need to resume this medication a day after the procedure. But if you have a bad kidney function and you have to hold more than 2 days, then probably you need to resume your Aliquid, Gerotobadexa maybe 2 or 3 days after the procedure. Again, you follow your doctor or the anticoagulant to manage your blood thinner medication, and your surgeon or a proceduralist. Have any further question or concern, let me know in those. Good Friday, everyone. I would like to talk about pharmacy law today. Um, a lot of patients and some pharmacists confused about pharmacy law every day, especially um, retail pharmacists uh, and people who work um, at the chain pharmacy like CVS, Walgreens, Walmart. Um, they face with the pharmacy law every day. So I would like to talk some important pharmacy laws that may be benefits for both patients and pharmacists folks. So I would like to talk about Schedule 2 to 4 controlled substance prescriptions. Schedule 2 uh, is different with Schedule 3 and Schedule 4 and Schedule 5 and the prescription only. So the Schedule 2, like oxycodone, um, you know, hydrocodone, morphine, uh, those medications, controlled substance, Schedule 2 or C2 prescription. So first, I would like to discuss about day supply. Okay, so excuse me. So the day supply of C2 prescription, um, the maximum day supply for the C2 30 days. But for some C2 medication, the maximum day supply can be 60 days, like for those medication or the dextroamphetamine or methylphenidate for the ADHD. So those medication um, can be 60-day supply. And some injectable infusion medication during the bumps, um, they might be okay for 90-day supply. So for these day supply limit is a different and vary state to state. So you may need to check with your state law to see what are the supply limits for Schedule 2 prescription? And the Schedule 2 prescription cannot be refilled. It's prohibited. So no refilling for Schedule 2 prescription. For some reason, prescription for Schedule 2 might be partial filled because they don't have enough medication in stock, so they out of stock medication, and in that case, the pharmacist might give you some partial fill, but it's very complicated to do the partial fill. Pharmacists need to dispense the rest within 72 hours, and if after 72 hours the patient not come back for the remaining, then the pharmacist must report to the prescriber, the doctor who prescribes the medication. This little, it has some a complication if something happened after the partial fill. And then it not permitted the patient request, so the patient cannot request a partial fill. The partial fill only occur if the pharmacy does not have enough medication in stock. So how long the Schedule 2 prescription is valid? Depend on state. Some state, it set the time limit like 30 days limit. After 30 days, the prescription is no longer valid. So to make a new prescription for C2 medication, if you cannot fill medication days. But for some medication, for some patients, like patients in long-term care facility, like a nursing home patient, or patient with a diagnosis of terminal illness, and the prescription may be valid up to 60 days from the day of issuance. So for the patient, the prescription can be filled within 60 days from the day the prescription was issued. So this is very important numbers and informations when you have the prescription for Schedule 2 controlled substances. You need to know some basic information to avoid, the prescription become invalid, and make sure you get enough medication, the total quantity, prescribed instead of production fill. If you fill with you out, then you cannot get the rest of the medication. And remember to fill the medication within 30 days. No refills permitted. Um, and then understand the state laws to make sure if you have the prescription for dextroamphetamine or methylphenidate for the ADHD, and some injectable infusion bombs, the medication for infusion, then you need to make sure you fill the medication within the time limits. All right, if you have any questions, please let me know in the comment below. I'm going to talk a little bit about Schedule 3 and 4 prescription. So, Schedule 3 and 4 prescription. There you go. Schedule 3 and 4 prescription. So again, the day supply for state law, some state law is the maximum 30-day supply per single filling, or be spent at one time. Federal law say maximum 34-day supply per single filling. But only a 5 refill and 6 months. You only have 5 refills within 6 months from the day of issuance of the prescriptions. So after 6 months, you cannot fill the Schedule 3 and Schedule 4 prescription. Make sure you know the time limit. And only fill 30 days supply or 34-day supply per single filling. Okay, so as long as you have enough for medication for 6 months, if you have 34-day supply, then probably you don't have 5 refills, maybe 4 refills. So it might be we need to do some calculation of 6 months is equal 24. Probably you have 4 refills if 34-day supply. For box refill, if the pharmacist unable to supply the prescribed quantity due to out of stock or the patient request, so it's different with the Schedule 2 or C2 prescription. C2 prescription, the patient cannot request a box refill. Okay, and then for state law, you might not exceed 30 days supply, and the total quantity in all box fillings may not exceed the total quantity prescribed. And then after 6 months from the day of the prescription issue, you cannot do a partial fill or any refill, nothing after 6 months. Again, the prescription may be valid for up to 6 months from the days the prescription issued. So these very basic but important information all patients and pharmacists should know to avoid any arguments when the time that the patient needs medication but cannot be filled, or too soon to refill, things like that. Generally, pharmacists may dispense the schedule prescription uh, um, maybe only 2 days earlier. Uh, if the patient want to get the prescription too early, they only do 2 day 2 days early for most of the scheduled substances. All right, so this is some pharmacy laws that it occurs every day, and then some a lot of patients they don't understand this why the pharmacist refuse to refill the medication too early, or why they cannot fill the prescription even though they have some refill remaining like that. And the pharmacies, the healthcare insurance may have some information. For example, if you fill the prescription multiple pharmacy, your insurance may let the pharmacist know that you already fill this medication from the other pharmacy. So the pharmacist will know if you already got the medication for the pharmacy. Right? If you have any question or concern about this pharmacy law, please let me know in the comment below. Thank you for. Oh, I'm going to continue some very important pharmacy law. This is just for patient information. Good to know this information when you have a prescription, get it filled at the pharmacy. So the last time I talked about Schedule 2, Schedule 3, and Schedule 4 controlled substances prescriptions. Now Schedule 5 controlled substance prescriptions, or C5 prescriptions. Again, you need to understand the days supply on the prescription. So no federal or state law regulating the quantity of this prescription, C5 prescription, or Schedule 5 controlled substance prescription. So no law saying, how many they supply I need anything feeling any one time. For the refill, no specific or set time limitation. So for the C5 prescription, the law doesn't say how many days supply can be refilled. It's not like C3 and C prescription. It limited 30-day supplies. So, but many states, may limit refills of C5 prescription by refills within a 6-month period. It's like C3 and C4. It limits to 5 refills in 6-month period. So it depends on where you live. Your state may want to set the limit, set the time limitation C5 prescription. The C5 prescription may be fracture fill. So there is no law regulating fracture fill for C5 prescription. But the total amount of all fracture filling but not exceed the total amounts required. And when the prescription is expired, it's no specific or set time for expiration. So many states consider the C5 prescription is similar to C3 and C4 C3 and C4 prescriptions. Then the prescription may be just valid for up to 6 months. It was issued. So it still depends on your states. Okay. But if your state has no specific or set time for expiration, then the prescription may be valid for 1 year. But most of the insurance company and the pharmacy system is set up for 1 year cut off for prescription. In other words, the prescriptions become invalid after 1 year which were issued. This is very important information for you as the patient understand, why they give you certain day supply, and usually for those states who have no regulation on the 5 prescription, and they might fill up to 90-day supply. It's just like regular prescription medication, so due to 90-day supply. But if it consider C5 prescription as the C3 and C4, then it might only give you 30-day supply. And again, check your state regulation to see if you can refill the prescription beyond 6-month period. And most of the prescription is not valid after 1 year. Those very important limitation of the prescription. Please let me know if you have any question for the Schedule 5 controlled substances prescription or C5 prescription. Thank you. So the large part of this type of pharmacy law is prescription only prescription. The RX only prescription, or some states they say C6 or Schedule 6 controlled substance prescription, either RX only prescription or Schedule 6 controlled substance prescription. So the day supply, so no law talking about the quantity may be dispensed at any single filling. So most of the insurance limit for 90-day supply. For people who travel overseas or something like that, might request 6-month supply, but like I say, most insurance companies limit for 90-day supply for prescription only medication. And then some medication, it's very dangerous to dispense over 3 months supply, like over 90-day supply, medication like antidepressant or antipsychotic. Those medication, they might limit to 90-day supply maximum. Like medication like a Seroquel or Lexapro or some medication require to monitor your blood, like Coumadin or warfarin. Those medications, they may not give you more than 90-day supply. That is the basic safety, not about insurance, not about the money. That is the safety. Most of pharmacists or the doctor, they don't feel comfortable, they are not comfortable to dispense more than 90. For the refill, there's no specific or set time limitation, but many insurance companies and pharmacy systems set for 1 year. After 1 year, you probably need to get a new prescription, or the pharmacy folks, they may call your doctor office to get a prescription renewed. Structural field is permitted, however, the total amount or quantity in all partial fillings must not exceed total amounts prescribed per prescription. So when the prescriptions expire, I just say valid for up to 1 year from the days were issued from many insurance companies and pharmacy systems. No transfer of refill for the prescription only beyond 1 year from the day of issuance of the original prescription. So, the pharmacy cannot transfer your refill to a different pharmacy if the prescription beyond 1 year. So after 1 year, most of the prescription is invalid of insurance companies or pharmacy system. You may ask a new pharmacy call your doctor to get a new prescription or get the prescription renewed. That's all you can do. That the old pharmacy cannot transfer your expired prescription, to a new pharmacy. So this is very important information for you as a patient to understand how the pharmacy fill your prescription at local pharmacy. When they get your prescription, they look at the day of the prescription were issued, and then the day supply, the prescriber or the doctor want, and then some prescription, they like some chronic disease, you might request 90-day supply, like high blood pressure or diabetes, high cholesterol, those disease, those medical conditions, a chronic medical condition require you to take for a long time, then you might request 90-day supply for your convenience. Then most of the pharmacists accept that request from you. You don't have to ask your doctor for that. You can ask the pharmacy to fill a 90-day supply as your request. And then you should know the most of the prescription is invalid or expired after 1 year. Then probably you need to get a refill before that. Otherwise, you need to have the pharmacist call your doctor office to get the prescription renewed. Some medication require you to see your doctor before they can renew. Most of the medication, within your mental health condition, like depression or anxiety or the the cycle problems, and and you need to see the psychiatrist before you get the prescription filled. Or some medication require to monitor your blood, like coumadin, need to get the lab blood test draw before they can renew your prescription. And like that, you need to work with your doctor. The pharmacy cannot help you with those things. Um, and within 1 year limit, the pharmacy can transfer your refill to a new pharmacy. For example, you got prescription with 11 refills, and then the prescription after 6 months of the day of insurance of the original prescription, then the pharmacist can call to a new pharmacy to get the prescription transfer. But after 1 year, they cannot do that. The prescription is no longer valid in their pharmacy system. I think most of the pharmacy set the 1 year cut off for the prescription only medication. All right, so that's all about the prescription. From C2, C3, C4, C5, and C6 prescription. C6 prescription is the regular prescription or the RX only prescription. Each state they call different. And so you may have to check with your pharmacy, your local pharmacy, to see how they call the Schedule 6 controlled substance prescription. Sometimes they call the RX only prescription. Sometimes they call Schedule 6 prescription or regular prescription. If you have any further question or any concern, please let me know. I'm willing to explain pharmacy law. If you confused or if you don't understand anything about pharmacy, please let me know. I want to clarify or make sure give you the good information that can help you understand why the pharmacy give your medication, why sometimes they don't. They review your prescription. Thank you. Have a good one. Some of my keep asking often go. I know. So when you go to Google and go INR, this here is a basically go up INR or the full range of INR is between 2 and 3 most indication, except for the mechanical mitral valve replacement or mechanical heart valve INR 0.5 to 2.5. That's correct, but of course the other special INR is 2.5 to 2.5, and not only way by the mechanical heart valve. Sometimes if people who have uh, um, different thrombosis or DVT or the AFib that cannot be uh, controlled by warfarin with the go-to. For example, people have been taking warfarin with the iron rank between 2 and 3, but still have stroke or still have recurrent DVT or PD. They may increase the iron range to 2.5 to 3.5. Make sure they're not having stroke or the recurrent DVT or PD when they are at therapeutic level. And sometimes they have the patient additional medication like aspirin, then the current DVT, OPD, stroke, and take over. And sometimes some people very high risk of bleeding. They may want to have those patients a lower iron range, maybe have to be below 1.8. Sorry, maybe 1.5 to 2.5. So for those people, they are very high risk of bleeding. Having the question is how in vegetables. So you should eat some greens, but you need to be consistent with your vegetables. You should eat same amount of vitamin A or same amount of greens every day to make sure your warfarin stable in your body. You have to eat consistent. You need to know how to measure your vitamin K. For example, spinach or kale contain a lot of vitamin K. So if you eat, I would recommend that you should eat low to moderate amount of vitamin K. So if you eat half of a raw spinach for one day, the next day you should eat like 2 or 3 cups of raw cucumbers or tomatoes like that. But dark leafy vegetables or dark leafy greens contain more vitamin K, like kale, spinach, light vegetables contain less vitamin K, like cucumber or tomatoes contain less vitamin K. So I would recommend that you should eat low to moderate amount of vitamin K, but you must be consistent every day to make sure that your warfarin stable stabilize in your body. Generally, when you see this question, can you eat food with vitamin K on Wolfman? Yes, I would say yes. You can eat some food with vitamin K, but you must be consistent and you should know how to measure the amount of vitamin K in each food in order to make sure you eat a similar amount every day. What foods should be avoided when taking warfarin? Well, I don't think that you need to avoid any foods when you're on warfarin, especially the food affect your warfarin like greens or vegetable. But some foods, may um, affect your bleeding, like garlic uh, or some other herbals. It may increase your iron, so it may increase your bleeding. So I uh, try to avoid those medication may cause bleeding. The vitamin K does not increase your iron level or does not raise your iron level. It decreases or it lower your iron level. So what it means when it's low iron level? So when your iron low, you are at increased risk of blood clot. When your iron level is high or critical, is increased risk of bleeding. That is why you have to make sure you are in stable and in the range. Um, there are two typical range. One, the normal range for certain medical condition like EVT, AFib, the normal range between 2 and 3 for the INR. For mechanical heart failure, the INR level is between 2.5 to 3.5. So it depends on medical condition. You have a different INR range. You have any further question on this topic or the issue? Please let me know in the comment below. Thank you. Hello, Yatu. This is a good question. What is difference between both Tylenol? Um, I say Motrin is a non-inflammatory steroid drug. So it's used for mostly for inflammation pain, like ache or muscle pain, muscle cramps, like that. Whereas the Tylenol is used for non-inflammatory pain, like my headache or my fever or my back pain. But just pay attention on the side effect for each of these medications so you profit. So, Motrin may affect your stomach like ulceration when you use very high dose or you take empty stomach. So, and then it may affect your kidney also. So, when you take Motrin, you have to take with a full stomach, and you can take 15 or 30 minutes after eating. Um, and Tylenol is may affect your liver. So you should not exceed 4,000 milligram of Tylenol for any circumstance. So generally you take 500 to 1,000 every 4 to 6 hours, but do not exceed 4,000 milligram a day. May affect your liver, especially if you have any liver disease. You should consider heavily when you take in Tylenol. And when you know drinking too much alcohol, you should avoid taking Tylenol. May affect your liver. So those this is very important to consider when you should take Tylenol or Motrin. That's pretty much what is different between Tylenol and Motrin. If you have any further question, please comment below. Let me know. Thank you. Hello. This is a very good question. Uh, Lots of people taking fish oil nowadays for their cholesterol um, and other medical conditions such as arthritis, inflammation, or uh, for the heart. So there are some drug interaction between fish oil and water. Um, some people may experience more bleeding or bruising when taking fish oil and water. So if you have any abnormal bleeding or bruising, you should report to your doctor. Anyway, before starting fish oil or any over-the-counters or herbals, you should check the doctor who managed your warfarin to make sure he or she aware of new medication or over-the-counters that may increase risk of bleeding when we are on certain medication such as warfarin. And I think fish oil may not affect other oral medications such as allergics or Yeroto. Hi, friend. Pam. It's a good question. Basically, this is a general question I used to have. Um, Typically, is no, we should not take Motrin while we are on warfarin because Motrin um, is a non-formulary steroid medication. It may cause bleeding when taken with anticoagulant such as warfarin or Eliquis, Yeroto, any type of anticoagulant. Uh, we should not take Motrin. So if you are not allergic, um, not allergic to um, Tylenol, you should take Tylenol instead of Motrin. Hello, young thing. This is a very good question. Uh, a lot of people ask me this question when I handle manage the community clinic. Yes, some people have to take both warfarin and aspirin. Um, but not a lot of people. Some people have to take both warfarin and aspirin. Aspirin generally take for the platelet or certain people, certain patients have the AFib, but they don't have additional factors, so they only need take aspirin. But when they have additional factors like over over 75 or have diabetes. So generally the JAK2 score over 2, they should take the anticoagulant instead of take only aspirin. But some people have to take aspirin and warfarin because they have additional conditions. For example, people who take warfarin for the AFib, and they have detected maybe aspirin for the stent. People who have the stent in their body, they may have to take aspirin for 1 year or so. Some people have to take the other end, anti-platelet, like Plavix. So, depending on your medical history, your doctor or your pharmacist will review whether or not you should take both aspirin or warfarin. Thank you for your question. Do you have any other further question? Please let me know. prior to the dental extraction procedure, you are taking anticoagulant like warfarin, Aliquis, or Xarelto. You should know what to do prior to dental extraction. If a simple extraction, like one tooth extraction, I would recommend not hold any retinal patient. But I would recommend test your eye now prior to the procedure if you are not stable. If your eye now you have a lot of eye now out range, especially higher your upper range. You should check your eye now prior to procedure to avoid bleeding. So, if you have multiple tooth extractions, then I would recommend to hold from 2 to 5 days prior to the procedure. You should check with your dentist or oral surgeon. You see what they expect. Some dentists they may tell you they want eye between 2 and 3, or they want eye less than 2 prior to the procedure. Then you will let your doctor who manage your warfarin know that your eye expect to be at certain level prior to the procedure. Usually, they want your eye on the day or within 24 hours prior to the procedure. So if depend if your eye excuse me, if your eye not stable, or higher than the upper range, like a week or 2 weeks prior to the procedure, then your doctor may recommend that you should hold your warfarin to make sure you get or you achieve the eye goal. Expect to be within 24 hours. So, for example, if your eye like 3.5, 2 weeks prior to the procedure, right? So, I would recommend you need to hold your warfarin 1-2 days prior to the procedure, and then you need to detach the eye on the day of procedure. So to make sure your eye at 2.3, 2 to 3, that what your dentist want. If your dentist want your eye less than 2 prior to the procedure, then you might need to hold for 3 days. If your eye for 3.5, 2 weeks prior to the procedure, and you need to hold like 3 days prior to the procedure to make sure your eye less than 2. So it still depends on what your dentist want or expect your eye level or goal before the procedure. If you have to hold your eye hold your warfarin for 5 days prior to the procedure. Okay, sometimes they have difficult or multiple tooth extraction. They might want you to hold for 5 days prior to the procedure. They want the eye level less than 1.5. And you need to hold your warfarin might be for 5 days or more, depending on your iron level. So you have to follow your doctor closely to make sure uh, you don't have any bleeding. So if you have to hold your warfarin for 5 days to get the iron uh, at less than 1.5, then you may need to be breached with the low enough injection or enoxaparin injection to avoid, you know, the blood clot or stroke, because you take warfarin to prevent the blood clot or stroke. And then if you require to reach with the low enough injection, then there is a instruction, when to start the low enough and when to resume low enough injection. You have to follow the doctor who manage the doctor who managed your warfarin. If you take Eliquid, Yeroto, or Badaxa, it's easier to manage prior to the procedure. Generally, for a simple extraction, you don't have to hold Eliquid, Yeroto, or Badaxa, but for multiple tube extractions or extensive oral surgery, then you might need to hold for 1 to 2 days this medication prior to the procedure. You don't have to be rich with the luminal injection when you hold less than 3 days. I think generally is safe, except for certain patients. They are so sensitive when they hold their blood thinner medication, even though 2 days they may develop the blood clot or stroke. So for those patients, you know, the surgeon or the proceduralist might need to consider the risk and benefits of holding the blood thinner medication. So that is very complicated. Patient need to work closely. They may need to be stay at the hospital before the procedure to make sure they are safe, or stay after the procedure for days to make sure they are safe from bleeding or blood clot or stroke. If you have to hold your warfarin or the Aliquid, Yeroto, Badaxa, then resume your blood thinner medication as instructed by dental or the surgeon. So, prior to the dental extraction procedure, you need to know if that a simple extraction or multiple tool extraction. If simple extraction, you may not need to hold your blood thinner medication. If multiple tools extraction or extensive oral surgery, then you may need to hold your warfarin for 2 to 5 days, depending on your iron level. And then if you hold more than 3 days, then depending on your medical condition, you need to be breached with the luminal injection to make sure you are safe from blood clot or stroke. And if you take Aliquid, Yeroto, or Badaxa, you may require to hold 1 to 2 days prior to the multiple tooth extraction or extensive oral surgery. And then you should resume your blood thinner medication as instructed by your dental. And if you have to be bridged with Lovenox injection, then you have to follow your doctor who manage your warfarin to make sure you know what day you need to start the Lovenox and what day and when you resume your Lovenox and when to stop the Lovenox injection. All right, if you have any further questions for this dental extraction procedure, please let me know in comment below. Thank you.